Hi, this is Matt Quinn, Community Relations with Rosecrance Health Network and member of the DuPage Prevention Leadership Team, a group that's committed to substance use prevention throughout DuPage County. I'm excited to participate in the 10 minutes of prevention. And today we're going to be talking about youth substance use during COVID-19 and some of the unique elements and challenges that youth might run into and professionals and parents might want to be aware of in terms of youth, particularly teens that might be struggling with certain elements of this during this crisis. So I think it's important to recognize with youth that although they may not be at high risk for some severe symptoms or death related to COVID, I think we don't want to be blind to the fact that there are still a lot of struggles that young people are going through related to this. High school related activities, particularly for upperclassmen, graduations, not being able to walk the stage, missing sports, clubs, proms. This is impactful. These are really important moments for young people that they're missing out on, and they're sad about it. And I think it's important to empathize and connect with young people about that. They might be feeling isolated. A lot of young people are connecting through social media, through FaceTime, other platforms, but we all know that's not quite the same as getting together with friends in person. So they might be feeling isolated. They might be feeling stress via their parents or other family members that might be losing jobs, financial stressors that come along with that, health issues. I think a lot of us are getting to the point where we're starting to find out about people, whether it's relatives or people we knew that might be dying from this virus. So I think it's important to recognize that teenagers are not spared from the stressors and challenges that come along with that. And it's an opportunity for connection, and any type of connection that young people feel to adults or professionals is going to be protective and help prevent substance use. Certainly, I think we all know during this that more teens are using social media, are gaming, and I think there could be challenges that come along with that. In terms of potentially using social media or gaming as a way to self-medicate potentially underlying mental health issues or the boredom they're experiencing because of this. One thing I really wanted to point out is a lot of the young people we work with, what prevents them oftentimes from using substances if they're involved in sports or clubs is a lot of those have contracts or agreements in place that really provide accountability that prevent them from using. So there can be, I worry about more of a what do I have to lose mentality if those clubs or sports have been canceled. So we have to be really mindful of that and try to find still elements of accountability and expectation that are set by parents or other people in the home so that they don't feel like, well, what do I have to lose if I start using substances? The warning signs in terms of what parents or professionals can look out for with substance use with teens are similar, but there's some unique ones that I wanted to point out that we're hearing about. It's certainly with mood changes and behavioral changes with teens being stuck at home with their parents or their family. We're going to see those ups and downs, that feelings of isolation. But I think if they're extreme, where they're acting very, very strangely, that could be related if they have been using substances and all of a sudden they can't anymore. That could be related to withdrawal. It could be related to all of a sudden now the parents are able to see their teen a lot more and maybe seeing evidence or signs of potential developing underlying mental health issues. There may be some depression or anxiety that's really spiking during this period, and it's a good opportunity for parents or professionals to be able to look at that and start to notice, hey, maybe these are signs that we need to get addressed or get looked at. Unusual smells, and that's not necessarily the smell of marijuana, that traditional skunk smell that some of us are aware of, but it could be smells like air fresheners or Febreze that maybe is meant to, because we have teens that we work with now that are still using in the home or right outside the home that are using mints or gum that they may eat or chew on, or smells to cover up their use. Or with a lot of the vaping devices now, particularly the nicotine vaping devices now, a lot of them have flavors where they smell like fruit, they smell like lavender, they smell sweet. So I think sometimes the nose can help in terms of leading and noticing some unusual smells, but it's not necessarily those traditional smells that parents may have looked for in the past. In terms of wanting to hang out with friends, I think that's a challenge overall, because I think young people, teens, they know, they hear that they're not necessarily at high risk themselves. Most of them understand that they can still spread the virus themselves if they get it to people that are high risk. But when you have young people that are really pushing and maybe leaving the home when they're not supposed to, or defying the rules of the home and going out when they're not supposed to, I always encourage parents to ask, what's going on there? What do they do? If they're really that insistent on going out, what's going on? What are they going to do? What are they, they can connect via virtually FaceTime and other platforms. If they're needing to go out that bad, what are they going out for? I've worked with some young people that are getting drugs dropped off down the street, where they're going, just stepping outside and then going down the block to pick up these drugs. So anytime young people, especially young people that maybe have a history with experimentation or substance use, anytime they're walking outside, we have to be mindful that they might potentially be going to do something that they shouldn't be doing. Keeping busy, as we know, is really, really important. I know that's challenging with everybody being stuck at home. I think it's important for parents to give some freedom, to allow their, maybe more than they usually do, in terms of allowing their sons or daughters to be able to connect with other people via some of those social media platforms or face-to-face type platforms that can help to stay connected. Now, restlessness, irritability, those are going to be expected with young people that are stuck at home. So we have to be mindful of that, and not think that just because young people are restless and irritable, that means they're using, or they want to use, or there's some mental health issue. So we have to be understanding and empathic with that. Structure, it's challenging, it's difficult. Hopefully the school is able to provide some of that schoolwork virtually, but providing chores, having family dinners, any way that you can provide at least kind of a basic skeletal structure to the day is going to help with some of that boredom, because boredom can be a huge trigger to use. It could be a huge problem that can get young people to get curious and to want to try things that maybe they wouldn't try if they had more structure to their day. The weather is important. I've noticed that myself with getting outside with our kids. It makes a huge difference with being able to even just go out in the yard, to be able to go for a walk, go for a bike ride, certainly being safe and keeping distance from people, but being able to go outside and exercise can help quite a bit. And I always encourage parents to try some of these apps yourself. Get on TikTok. Don't be afraid to make a fool of yourself and do a dance video on TikTok with your kids, or get on yourself and send it to your kids and give them a good laugh and have them roll their eyes at how ridiculous you look trying to do a dance routine, or get on Snapchat and use some of the goofy filters. So I think there's ways to use it as a source of connection and not just using social media as the enemy. I think there's ways to utilize it as a source of connection and not just something to be afraid of. Now, this might be, in terms of taking advantage of time together, this can certainly probably be a challenge, especially at this point where a lot of us have been in close proximity to family members for a while now. But I always encourage parents and professionals that are still working with young people to use this as an opportunity to listen and to there's more time for conversation, and to not push it, because even in this situation, young people aren't necessarily going to want to talk to their parents all the time. But using those times at dinner, or when you're just sitting around because you don't have as much to do, and just talking about just the overall challenges of being a teen, or the challenges with being socially distant, or being kind of shelter in place. And then maybe trying to figure out, and talk about the pressures to use maybe a few months ago or during the school year, or now, asking them, hey, through social media, do you find that people are still talking about this, or do you get offered this? Talking about vaping and all that that's going on. It's just trying to take advantage of that time, but also, continuing to reinforce those expectations, because the reality of it is that young people now don't have necessarily accountability, like I talked about earlier with clubs or sports, but also with school in general. They don't have teachers with eyes on them. They don't have deans with eyes on them. So it really is, in some ways, the burden is on the parents right now to provide those expectations and be those eyes and provide that accountability for their sons or daughters with potential substance use. I know with virtual support with Rosecrance, this is something that we've kind of had to adjust to, in terms of doing assessments over the phone versus face-to-face, and doing outpatient services virtually. I know for myself, using video formats initially was awkward. But I think what I've noticed, and most people would agree, is that you get used to it over time. So any young person that might need outpatient treatment that's virtual, or a meeting with a therapist that's virtual, or any type of support now that's virtual, I always encourage them and empathize with that awkwardness and say, yeah, at first it is going to be weird looking at yourself in the computer screen and not being able to connect face to face, but you get used to it, and encouraging them that you do get used to it. Then you can't beat the convenience of it in terms of being able to meet from your home versus having to go to an office. So there are a lot of conveniences to it. A lot of programs have embraced it. We've embraced it. I know working a lot in the recovery community, AA and NA have really embraced it. And trying something new. Teenagers oftentimes are very open to trying new things. It's part of how the teen brain is wired. So encouraging them, hey, this is something new. This is a way to branch out from social media and maybe the virtual platforms they use. But the reality of it is I think a lot of young people now are used to, especially now that this has been going on for a while, a lot of them are already used to connecting with their friends via video. So that transition to maybe supportive treatment services via video may not be as much of a transition as it is for us adults, or how that's been. A couple miscellaneous things that I want to talk about that I think are important and relevant to this. Now, with the first bullet point, you might notice there where it says shortness of breath, fatigue, chest pain, ventilators. I think when we hear that now, we think of COVID-19. But what's important to realize is that 6 months ago, or in the fall and kind of the early part of winter, late summer, that these are the symptoms and these are what we were seeing when there was that outbreak with vaping and young people ending up in the hospital, ending up some of them on ventilators. And so I point that out for a reason, because everything you hear about with COVID-19 in terms of how severe it is vulnerabilities. And there's a growing body of evidence that's showing that vaping, especially heavy vaping, it compromises lung function, and it weakens immune response. So that's not to say that young people that are vaping are at risk necessarily of death, but I think they are at risk potentially. And I do want to say that there isn't necessarily the body of research around this yet. This is more just kind of a word of warning, that because of what it does to lung function and immune response, that it could lead to more severe symptoms with young people. But the caveat being that the research isn't out there yet. This is still too new to have the research. So I don't want to mislead people into thinking that we have a growing body of research that indicates that vaping makes someone necessarily at risk for severe symptoms. But if you look at the profile of what young people were struggling with when they were going into the hospital with vaping related lung illnesses, it would be logical to think that their risk level for more severe symptoms if they catch this virus might be a little bit higher. So I wanted to point that out. Another thing we're hearing a lot about is that alcohol use among adults has really jumped. If you look at the statistics from last year to this year, it's gone up 55%. That's a huge jump. So I bring that up for a couple reasons. One is, for parents in general, I think we have to be careful of what type of modeling we're providing for our children, particularly teens. And if they're seeing 55% more drinking, that could be modeling an acceptance, kind of an implied acceptance of it through that. The other piece to it too is, if parents are drinking and their teens are around them a lot more, I think it is important to have that discussion about the differences between adult alcohol use and young people or teen alcohol use based on brain development and risk for progression and other things, not to make it necessarily an excuse to say it's okay, but there's a reason why the laws are in place around 21 and older, and that it's really an apples and oranges comparison, that an adult drinking a glass of wine or an adult drinking a beer is much different than for various reasons, including brain development and future risk. So I think there's an opportunity potentially there around that. As we're wrapping up, I did want to mention a couple things. One, I did want to mention the crisis text line. This could be for really any mental health crisis. It could be for depression, anxiety, eating disorders, self-injury, suicidal thoughts. This is just meant to be a way, a 24/7 way for anybody to get in touch with somebody and to reach out for support just by texting reach to 741-741. It's an opportunity to connect with someone and hopefully get support for whatever that crisis is or whatever that potential issue is. And then I did want to just put my contact information with Rosecrance. And like I mentioned earlier, we've had to adapt by providing phone assessments and virtual outpatient services. We still do have residential substance abuse and mental health services in Rockford in person. We are very, very vigilantly and rigorously screening people that come in to make sure that we're doing everything we can to prevent COVID from coming in the building and being really, really careful about that. And that's gone well so far. So I wanted to thank you for letting me participate in this first episode of the 10 Minutes of Prevention, and thank you.